children's heart health just isn't up to AHA's standards. Shouldn't really be much of a shock. America's children have a heart health problem, and it could become more of a problem upon adolescents if they don't change their negative habits and leverage the tools available to them. That was the main takeaway from newly released data from the American Heart Association, analyzing the heart-related metrics of children and adolescents alike. These numbers unfortunately show that a good percentage of American children have heart health levels that are not up to the organization's standards, rating at intermediate or below average levels in most of its key metrics. Not surprisingly, given the ongoing obesity and overweight epidemic and how it affects Americans of all ages, this is due to a lack of physical activity and poor diet choices. According to the AHA's report, most children in the U.S. don't consume heart-smart diets, and also don't get enough exercise, two things that help contribute to people having the ideal level of heart health. Most children scored below average on dietary metrics, while only 1/3 to 1/2 of children got enough daily physical activity, as recommended by the AHA. The organization has its own criteria that defines whether a child's heart health is ideal or not. Per the AHA's definition of ideal or optimal heart health, children are expected not to have tried smoking cigarettes, to have a BMI under the 85th percentile, to get at least an hour of moderate to vigorous physical activity, to have a healthy diet score on 4 or 5 components, to have a total cholesterol level under 170 mg/dl, to have blood pressure below the 90th percentile, and to have fasting blood glucose levels under 100 mg/dl. Engaging in these ideal health behaviors early in life can have a tremendous benefit on maintaining ideal health throughout the lifespan, said the AHA's Dr. Julia Steinberg. Instead of taking a wait-and-see approach by treating disease later in adulthood, we should help children maintain the standards of ideal cardiovascular health that most children are born with. Another disturbing trend observed by the AHA was how unhealthy behaviors seemed to escalate as children aged into adolescence. Only about 50 to 60% of adolescents had a healthy BMI, 19 to 27% had a poor BMI, or one above or equal to the 95th percentile, and a third said that they had smoked a cigarette at least once within the last 30 days. AHA. In terms of heart health variables, over a fourth of children aged 6 to 11 were at an intermediate status for total cholesterol, while 10% were at a poor status. This went up to 26 to 35% of adolescents having intermediate or poor total cholesterol levels. Likewise, 20 to 38% of adolescents were reported to have intermediate or poor fasting blood glucose levels. But on a positive note, almost 90% of children and adolescents had ideal blood pressure levels. Speaking to MedPage Today, study co-author Dr. Donald Lloyd-Jones said that children should access the tools they need to correct most of their unhealthy patterns by consulting with their pediatricians. Pediatricians are our most important partners going forward, he said. They have the power, along with the schools and public policy, to really help reverse this epidemic. If we can improve eating patterns and increase physical activity among children, we can dramatically alter their life course.